put together a few little slides. So my name is Jennifer Goulet. I am the Substance Use Disorder Program Manager at North Country Health Consortium for their Petra Direct programs, which includes the Ask Petra Call and Resource Center, as well as the Wellness and Recovery Model program, lovingly called the WARM program, and the extension of services to reduce instances of neonatal abstinence syndrome in the North Country, which includes our WARM for Women program. We also offer what's called North Country Recovers Together, which is a tri-county coalition aimed at improving outcomes for individuals in recovery and their communities throughout the North Country and Carroll County. And we offer all of the core training for certified recovery support workers in the state of New Hampshire. That being said, I actually was asked to come here today and talk to you guys for about 20 minutes or so, a little bit about harm reduction. So what I would like to do is kind of give you harm reduction 101, which is just a basic foundational knowledge of harm reduction. And so that starts with the only objective for this morning is to understand the basics of harm reduction. Do you guys know how to use your chat or your raise hand function in WebEx? Yeah? You're awfully quiet. Okay. So using your raise hand function or just raising your hand if you're on camera, very simply, I'm going to ask you guys a couple of questions, and I just want to know if you use these things. How many of you use sunblock when you go to the beach? Right? How many of you put sunblock on your kids when they go outside? Okay. Excellent. How many of you wear a seatbelt? How many of you own a fire extinguisher? Excellent, excellent, excellent. Okay, so everybody is familiar with harm reduction, whether you have thought of it this way or not. So the first thing I want you to know about harm reduction is that it is familiar, right? We wear sunblock, we wear seatbelts, we put our children in car seats. We talk to teenagers about safer sex. We put together these ideas of protection, right? And we call this prevention. Prevention and harm reduction are essentially one and the same. We don't start hearing a lot of kickback on the term harm reduction when we start talking about sunblock and vaccines, but we hear a ton of kickback when we start talking about harm reduction in substance use circles. Okay? Why do you think that is? One? No? All right. I'm going to give you a couple of reasons why that is. Stigma, Stephanie in the chat. Thank you. Stephanie did throw stigma in the chat. Stigma is the number one reason that we hear kickback related to harm reduction when it comes to substance use. There is so much stigma built in around this recovery pathway. That is rooted in the fact that many of us don't understand what harm reduction is and what it is not. So let's talk a little bit about what it is then. So harm reduction is actually a set of practical strategies and ideas that are aimed at reducing negative consequences associated with substance use. This makes sense, right? Any of you know any of these strategies? A couple of you, I see your heads shaking a little bit. Okay. Julie, did you just throw your hand up to answer? Anybody? Nope. All right. You guys are a really quiet group. It's also a movement for social justice and personal freedom built on the belief in and respect for the rights of people who use substances, right? So remembering the fact that we are all just people. Everyone is human, and therefore everyone has basic human rights, including those who use substances. It is also a framework for working with people who use drugs. PWUD is the acronym that you may see often for people who use drugs. This is the one time you're going to hear me say it as people who use drugs. I generally refer to this as people who use substances. Some of changing stigma refers to changing the way we use our language. So people who use substances is the preferred term now. And then it is a framework for understanding substances and substance use. Out of curiosity, show of hands, how many of you knew there was a framework for understanding substances and substance use? Right. One or two of you. Okay, thank you. So here's what harm reduction is not. Harm reduction is not this whatever happens, happens attitude. When we say whatever happens, happens, how are we reducing harm? We're not. So it is not this whatever happens, happens attitude. It's not an anything goes attitude either. Harm reduction is not only meeting people where they are at, which is a good portion of what we do, but it's also supporting people to change their behaviors moving forward. Uh, when we start looking at things like recovery, recovery requires changing the way we see things, the way we react to things, the way we cope with things. It's all of these pieces. And you can't replace these negative behaviors without healthy behaviors. And that is because every behavior serves a purpose. Even those negative, undesirable behaviors serve a purpose in the time. Okay. It's not helping a person who has stopped using to start using again. If somebody has come to me and they have completely stopped using, me helping them use again is not harm reduction. I didn't reduce any harm to them. I actually put them back in harm's way. So it's not this idea that if you're no longer using, it's okay to use. It's also not condoning, endorsing, or encouraging substance use. And we're going to talk a little bit about why and how that works. And then harm reduction is not legalization. I hear this a lot, especially when we start coming back to this first slide that I was just showing you guys, the idea that this is a movement for social justice and personal freedom, right? As a movement, we start looking at things like, well, what about legalization? Harm reduction is not legalization. Legalization is something completely different, and it does not fall within harm reduction purviews. However, standing up drug treatment courts, that is harm reduction. Does that make sense to you guys so far? Okay. All right. Does anybody know who this gentleman is? Anyone? I have no harm reductionists in the room. Okay. The gentleman that is staring back at you, his name is Norman Zinberg. Norman Zinberg is the individual that we lovingly refer to as the godfather of harm reduction. Before it ever had a name, before anybody called it harm reduction, he was out there doing it. Okay. And so he was out there set up outside of buildings with sterile syringes, with sterile water, with all of these pieces. And Norman Zinberg actually came up with the framework for understanding substances and substance use. So this framework is simply referred to as drug set and setting. Okay. So let's break it down a little bit. When we start looking at drug, or my preferred term, substance and use, when we start looking at the substance that a person is using, we need to understand what the substance does to that person. Every substance fits a different receptor, okay? They all trigger your reward center, and that's what contributes to the development of substance use disorder. However, they all fit different receptors. So what does the substance do to a person? We need to understand what potency and purity looks like. So what does it cut with? What is their route of administration? Do you guys know what route of administration is? A couple of you are shaking your head, yes. Um, for those of you who do not know, that's the idea of how you are taking a substance, whether it's injection form, whether a person is using their nasal passages, whether or not they are smoking and inhaling it, or it's something that they are putting underneath their tongue and absorbing, or it's a patch on the body. Route of administration varies by substance that we use and by individual. So route of administration is important when we start looking at the substance, and that is because not all routes of administration are created equal. Does this make sense? Certain things are going to put it into your bloodstream or bring it to your brain much quicker than other things. And then whether or not a substance is legal or illegal as part of our substance use, as part of our substance in use. And this matters because whether or not a substance is legal or illegal changes the amount of harm that can be done, right? So when we do illicit substances, there's no guarantee that things like fentanyl are not present or xylazine. So things like legal or illegal actually change a person's risk. When we start looking at the set, this is what the person brings to the table. This is their unique physiology. So it's their physical and their mental health that they're coming in with. It's their cultural identity, their culture of origin, and their sense of belonging. It's also expectation of use and their motivation for using, right? So, why is this person using? And then, what is their expectation of using this substance? Is the expectation that they're not going to have to feel anything for the next few hours? Is the expectation that they've just relieved everything previously? Is their motivation for using based on a culture that they grew up within where this was acceptable within the household and they don't know any better? Or is it something completely different? So, all of these pieces are what that person brings to the table. So, the set is always going to change, right? Because even if you have two people, the same age, the same gender, the same background in your room using the same substances, their physical health is going to look different. Maybe one is an athlete and the other is somebody who is struggling with diabetes. So their physical set's going to look different. Their mental health is going to look different as well. So set is always changing. Setting is the environmental factors surrounding the person who is using. So this is the stressors that are brought into their life. Um, and while we're talking about harm reduction and stress, just really quickly, I would challenge you guys to think about stress a little differently, right? When we're working with vulnerable populations, when we think of stress, we think of things like being unhoused, not being able to pay your electric bill, right? These general social determinants that people are struggling with on a regular basis. But stress is so much more. A promotion causes stress because it causes change. How many of you ever gotten married or had a baby? Yeah, pretty exciting, right? But really, really stressful. So, even just challenging the way you think about stress is going to challenge the way you meet people. Okay. So, recognizing that somebody can be in recovery and still be struggling with positive change as a trigger and a stressor. The support. What does that person's support system look like? Do they have support? Do they have close friends and family? Is their support system that culture they grew up in where everybody is actually using in the household? And is that actual support if that's their structure? And then who and where they're using with, right? People, places, and things matter in recovery and they matter in harm reduction as well. So, who and where they're using, and where kind of comes down to things like, are they using in clean areas? Is it well lit? Do they have access to naloxone with the person they're using with if fentanyl is present in their substances? And then the social and cultural attitudes toward their use and the substance that you're using. Okay. So culture and social attitudes do change based on substance. We see this a lot with there is a overall social acceptance of the use of alcohol in the state of New Hampshire, right? Because it's legal. There's an overall acceptance with the use of cannabinoids like marijuana because we've turned a point where it's now been decriminalized and many states it's illegal. Whereas if somebody comes to you and they tell you that their substance of choice is opiates, it's fentanyl, it's heroin, it's stimulants, we see a different attitude. Our cultural and social attitudes are different towards that. So the framework of drug set and setting kind of helps to establish what it's like to meet somebody where they're at when you're practicing harm reduction and what to expect in that process. So, goals for harm reduction, there are overall goals. It is to improve the health and well being, not just for the individual who's using substances, but their partners, their families, their friends, and their communities. It's also to highlight and address the roles of discrimination, poverty, racism, classism, sexism, social isolation, trauma, and other inequalities in drug related harm. Okay. And the roles of dignity, respect, and empowerment in reducing harm. All right. Before we go too far, I wanted to ask you guys what types of harm reduction pathways are you familiar with right now? Anyone? I'm going to say that means you're not familiar with any. Nobody responded. So we're going to say you're not familiar with any. Oh, wait, I have an in the chat. In the chat, somebody did put clean needle programs. So, yes, sterile syringe programs, SSPs, are a form of harm reduction. What else? Naloxone. Thank you, Amanda. Amanda threw that in the chat. Naloxone is a form of harm reduction. What else? Managed use, Nicole. Thank you. Strength-based approaches considered harm reduction. Yes, it is. What else? Anything else? How about information on safer use? What does that look like? Information on safer use. Which substances are safer? Which places are safer? Using with somebody instead of alone. It's never safe to use alone, right? Especially if naloxone is required. So those are some safer use strategies as well. We look at things like changing substance or changing route of administration, programs that to help and reduce use. Excellent, thank you. What about medication assisted recovery? Yeah, it's harm reduction. We often refer to it as a clinical pathway, and it is because it requires clinical perspective. It requires a physician who is prescribing, it requires monitoring. But medication assisted recovery or medication assisted treatment or medication for opioid use disorder, however you want to, term it, it's harm reduction. And why does it work? Anyone? It works simply because dead people do not recover. The whole goal of harm reduction is to keep people alive long enough to find recovery, whatever that may look like for them. So, harm reduction actually exists on a continuum, just like substance use exists in a continuum. This model right here with the staircase, I love this model because it can be applied indiscriminately to any health condition, right? But let's just kind of frame it for a moment for substance use disorder. When somebody is not using at all, they're considered abstinent. They're at the bottom of the staircase. They have the lowest risk associated with substance use disorder because they're not using any substance. As we start to climb the staircase towards moderation, our risk begins to increase. As we move towards excess, which is what we would consider that chaotic use, this would be that substance use disorder clinical background right here, this excessive use. Okay. As we climb the staircase, we increase our risk. Okay. So somebody can be diagnosed with substance use disorder. They can be at the top of the staircase in chaotic use, and they can make a small change. They can say, I'm not going to use in the morning anymore. I'm not going to use before work. I'm not going to drink and drive, right? And that starts to decrease their risk. They can say, I'm not going to use it all anymore. And they jump to the bottom of the staircase where risk is pretty much gone. Very often, though, we don't see our clients saying, I'm going to jump to the bottom of the staircase. Yay, me. More often than not, we see our clients taking one small step. And one small step is a step back. It's a step down that staircase. It's a step toward decreasing their risk. All right. So I want to end this. Will you guys be able to hear sound if I share the video on WebEx? That's not going to be a problem, right, Emily?
It should go through, yeah. When you hit share your screen, did you click the little box that said share sound?
Let's find out.
Okay.
Share my screen. Share. Oh, it didn't offer me a box to say share sound. Oh, include sound right here. Got it. Excellent. Okay. So I'm going to play a very quick video for you guys. This is naloxone focused, but as we all know, naloxone is harm reduction. And it does kind of drive home the point that dead people do not recover. So while I'm playing the video, I am going to shut my camera off and mute myself just to remove any lag that may be there. Okay. So if you guys can't hear it, somebody needs to wave frantically at me.
I can't hear it. Can anybody else hear it? Oh, there we go. Okay, now
This
it's
was a
on.
picture of me on Christmas 2014. I was sitting in a chair in a hotel room overdosing. Shortly after that picture was taken, they realized they couldn't wake me up, and they They called 911. And that was one of my first trips to the hospital for an overdose. I've been in recovery now for almost 4.5 years. I was a IV drug user. I was a heroin user. I was also used meth and crack cocaine. I ended up going to a rehab center in October of 2016. I went through the detox, and it being my first visit to a real treatment center, I had the idea that somehow I was cured after that detox. I met a guy who was in there also who told me that he could get a prescription of medication. We left together. Within a matter of hours, we were high. And when I woke up that next morning, he was gone. And so were all the drugs. And I broke down. I remember just bawling my eyes out, picking up the phone, and the only place I could think about calling was the treatment center that I had just left. Everyone had pretty much given up on me and come to terms with me dying. I imagined that they would tell me that, no, Daniel, you don't get to come back. You don't deserve it. You were given a shot and you blew it. But when I picked up the phone and dialed the number, this woman answered. And I expected her to tell me that I wasn't allowed back. But instead, she said a few simple words that changed my life. Baby, it's gonna be okay. I have a beautiful 3-year-old girl that would not be here today if I wasn't saved by Narcan. This is my daughter, Harley. Man, she's the light of my life. And to think that she would never have been born if I had never been Narcaned, if I had never been told those words, baby, it's gonna be okay, if nobody had ever showed me compassion.
Happy birthday to you. Happy birthday to you. Happy birthday, dear Harley. Happy birthday to you.
Makes me feel grateful to have been given another chance. Umpteen chances. Narcan's important for the simple fact that it's a life-saving tool. It's what they call harm reduction, just as compassion is. You're giving this person another chance at life. And sometimes looking at that individual and seeing where they are, you can't help but feel judgmental. But we have to look outside of that box, right? Because you're not just looking at an addict, you're looking at someone's child. You're looking at somebody's, a child's mother, a child's father. And I'll tell you what, they will do anything to get that person to come home. Why don't we hand out EpiPens? Why don't we hand out inhalers? I wish we did. Maybe we will one day. Change starts with change. Changing your perception on one can then in turn help others change their perception on the other. One of the things that everybody thinks is if somebody knows how to get drugs, they know how to get help. And that isn't the case. A lot of people, before they know it, they're lost in the madness of substance use. But that doesn't mean that they know how to get out. We'll continue to lose our loved ones until we come together and we come to an agreement and we know that Narcan is not an enabling tool, it is to give this person another chance. And if it is not to give this person another chance, let's give their family one. Because I promise that they will thank you. If we give them Narcan, in turn we're showing them that their life matters. That is compassion. If this patient is sick and we give them buprenorphine, it is not enabling. It is we are reducing the harm that can be caused to them out in these streets, the additional trauma that they experience. We're giving them a chance. Again, we are giving this family a chance. We will give them another chance. I believe in them, as others believed in me. The woman that told me, when she said, baby, it's gonna be okay, she changed my life forever. And she probably doesn't even know it. But I do. My family does. And my daughter does. And that's what's most important. We have to remember that addiction is a disease and that this patient lost the choice a long time ago. So let's do what we can to give them that choice back. Let's remind them that there are people out here who love them and care for them and that their life does matter. If it doesn't matter to them, it matters to me. Somebody cares. Somebody loves this person. How addiction begins is not our choice, but we can do something about how it ends.
Okay. Before I leave you guys, I was graciously granted a little more time by Emily because your other presenter canceled. So thank you for that. Before I leave you guys, I want to revisit something I had previously said to you. I said harm reduction is for more than just the individual, right? It affects their families. We can see that illustrated in this video, but I said it's also for communities. What are some of the harm reduction strategies that you're familiar with, or some of the things we're trying to reduce in community through harm reduction? Anyone? How about this? Spring is approaching. It's fast approaching. Let's hope it's fast approaching. Spring is approaching. What is the biggest thing you see on social media during spring cleanup? I found a needle on my playground, in my front yard, on the side of the road, right? And that's a problem because used syringes have the potential to transmit disease like HIV, hepatitis C, even other diseases, right? So if we don't want to find needles in our playgrounds and in our front yards and on the sides of our streets, we offer harm reduction tactics for people to dispose of them properly. Safe syringe programs do this. They will go around and collect used syringes and then provide individuals with sterile syringes for every used syringe they have submitted to them. So practicing harm reduction, yes, it's going to help save somebody else's life. It's going to continue to build families and give people second chances, but it's also going to reduce disease within our communities. Have any of you heard of the Discern study? Anyone? Okay, so the Discern study was done by the University System of Northern New England, including multiple different states. What they did in our area is they studied towns and cities along the I-91 corridor. Why the I-91 corridor? Anyone? Runs straight through multiple states, Massachusetts, Vermont, New Hampshire, all the way up to Maine. It is considered one of the longest and most traveled drug trafficking corridors in our area. So they surveilled these little towns. Do you know which towns they came for the North Country? Littleton and Berlin. Okay. These two places could not be more vastly different. The one thing they had in common is they both sit right off the I-91 corridor. Okay. A van parked in both of these places, and it offered randomized testing with a promise to connect you to treatment if you tested positive for anything. What they found through the Discern study was that almost 80% of the people that they had tested positive for hepatitis C. Many of them did not know they had it, and more than 50% of them admitted to sharing syringes with others, which means they were transmitting it. This matters because, have any of you ever heard of Scott County, Indiana? No? Okay. Scott County, Indiana is an area that if you lay it over the North Country of Northern New Hampshire, it's almost identical. Vastly geographic with lots of travel time in between to go see doctors, physicians, treatment, all of these things. So Scott County, Indiana actually suffered the largest HIV outbreak ever on US soil. And it was connected to a lack of harm reduction tactics, this geography that we see in Northern New Hampshire, and these small towns. So the Discern study showing us these high prevalence rates of hepatitis C said, you are prime for HIV outbreak in Northern New Hampshire, just based on your lack of harm reduction resources. Okay. This is more than just one person. Harm reduction is about entire communities and families and everything else that you could possibly think of. with that, I do just want to kind of offer you guys the opportunity to learn more. This was just a very brief overview of harm reduction. We also offer multiple other classes related to harm reduction, trainings, I should say, related to harm reduction at North Country Health Consortium, including a harm reduction basics with naloxone train the trainer. I can share a link to the Discern study for you guys. I will send it to Emily to share in the meeting minutes. Emily, is that okay? I should have asked you first. I'm
Yeah,
sorry.
perfect. No, that's great. That's great.
Okay.
Yeah.
I will
Thank
send
you,
you the
Julie, for
Discern
asking that.
study. Also, that being said, I'm going to pop my email in the chat if anybody's looking to connect. Reach out to me if you have any questions, concerns, would like more information, whatever it may be. Please let us know. On that, I want to leave you on a bit of a high note. It's also a self-serving high note. I fully do admit that. So very quickly, can you all still see my screen? Is it displaying a website or is it displaying
Yes.
slides? It's displaying
No,
the
we can see
website.
the website. Yeah.
Excellent. Thank you. Very briefly in the beginning of this presentation, I said to you guys that I'm the program manager for a program called Petra Direct and all of its little programs in between. One of those programs is the Ask Petra Call Center and Resource Center, which does have a DIY website. If you came to our website, this is the first thing you would see. If you clicked here, I'm not ready, it says we meet you wherever you are. Okay. So this actually is harm reduction. We are putting this out through our website. We offer access to Save One Life kits, which includes naloxone. It includes fentanyl test strips, xylazine test strips, a bunch of other materials, as well as information on access to screening and testing for hepatitis C and HIV, as well as information on treatment. Something else that we offer is secondary distribution. So somebody reaching out to our program saying, I'm not ready, and here's why, we can say, let us get you a harm reduction kit to start. We can set you up with a community health worker recovery coach who's going to follow you through on this journey. We're going to help monitor your progress and figure out what is working and what is not, and how do we get you to where you want to be, as opposed to where I tell you you should be. It's all about where a person is capable of being and wants to be. So we actually are not just talking the talk, we're walking the walk up here. So with that, I just wanted to say thank you.
That was excellent. Thank you so much. I have two questions potentially. Is I noticed on your website you have the picture of the vending machine with the naloxone. Are there any other of those throughout the state or just up in the North Country area?
That's an excellent question, Emily. So currently, to my knowledge, the first and only vending machine for 24-hour no-cost access to naloxone is in Littleton, New Hampshire, outside of the Mount Eustis Common Building, which is where our office is located. We did receive some funding, not through grant funding, but through an anonymous donor who said, what are the things NCHC would like to have? And top of that list was a second vending machine. So currently the only vending machine is in Littleton. However, we are looking to stand up a second no-cost access to harm reduction supply vending machine in Coos County right now. So there will be a second. I do know that we've had conversations with other organizations out of Southern New Hampshire who are looking to be setting up a vending machine as well. So we've been able to guide them through that process and connect them with the vendor. So we're also willing to have that conversation if you're interested. That was a great question.
That's excellent. Thank you. And my second question is, as you talked about the needle exchange program, where would we find out where those are in the state?
Ooh, excellent question as well. Are any of you familiar with the New Hampshire Harm Reduction Coalition? Anyone? Okay, so New Hampshire Harm Reduction Coalition actually has on their website where you can locate all of your syringe service programming throughout the state. It does list for the North Country. It doesn't list anything right now for the North Country. North Country is kind of bare if you're anybody who's working within Northern New Hampshire above the notch. However, there is the H2 harm reduction. It's the HIV HCV Resource Center. I apologize for that. HIV HCV Resource Center, which was initially started by Dartmouth Hitchcock students and has been since taken over, which runs a mobile syringe service program and does have brick and mortar building. And they will come as far as Littleton, New Hampshire. As far as if you're in the North Country and you're looking for syringe services for your organization to have, or for clients that you're working with, you're welcome to reach out to us and we can provide them with all of their starter kit pieces. And a starter kit is extremely important because most of us assume you can only spread disease through used syringes, sharing those syringes, and that's actually not true. Using and sharing water, sharing cotton, sharing cookers, all of that can spread disease. HIV and hepatitis C live outside of the body on the surface for extended periods of time. So just all sterile works is extremely important to reducing disease.
Awesome. Thank you. That was great. And as you were talking, I Googled those sites and put them in here, but that's really great to know where those are available.
Excellent.
Perfect.
Thank you.
Does anybody have any other questions?
Great.
Right, I'm going to stop the recording. Thanks again. That was a lot of